Hello everyone, in this video we're going to talk about the gut microbiome and its relationship to obesity. This is a 2013 paper called Gut Microbiota from Twins Discordant for Obesity Modulate Metabolism in Mice. This was published in the journal Science. In the scientific world, there are two journals that are the premier journals. One is Science, which is a journal published in the United States, and the other is Nature, which is a journal published in the United Kingdom. So most landmark scientific discoveries are published in one of these two journals. And this one was published in September 3 of 2013. Let's read the abstract together. Establishing whether a specific structural and functional configurations of human gut microbiota are causally related to given physiologic or disease phenotype is challenging. Twins Discordant for Obesity provide an opportunity to examine interrelations between obesity and its associated metabolic disorders, diet, and the gut microbiota, transplanting the intact, uncultured, or cultured human fecal microbiota from each member of a discordant twin pair into separate groups of recipient germ-free mice permits the donor communities to be replicated, differences between their properties to be identified, and impacts of these differences in body composition and metabolic phenotypes to be discerned, and the effect of diet by microbiota interactions to be analyzed. In addition, cohysing coprophagic mice harboring transplanted microbiota from discordant pairs provides an opportunity to determine which bacteriotaxa invade the gut communities of cage mates, how invasion correlates with host phenotypes, and how invasion and microbiome niche are affected by human diets. Okay, uh, if you're not used to reading scientific papers, that sounds like a lot of mumbo jumbo. What they're saying is trying to figure out what gut microbiomes do is hard. And so what they're saying is that when you have twins, because twins are very similar in their generally very similar in their lifestyle, similar in their genetics, and definitely they're the same age. So they're similar in many other ways, and so but they're different in obesity. Maybe we can figure out if their gut microbiome has something to do with it. So what they're going to do is they're going to take the gut microbiome from these twin pairs and place them into mice, and then they look at what does that do to the mice. So their methods is separate groups of germ-free mice were colonized with uncultured fetal microbiota from each member of 4 twin pairs discordant for obesity. So what they were doing is they had mice that were grown in a germ-free environment, so they had no gut microbiome before. Then they were given the microbiome from 8 people, so 4 pairs of twins. And these twins were discordant for obesity. That means one of the twins was obese and one of them was not. And then they measured them. All right, so let's look at this. This is the data. If you look at this picture, these are the lean donors. So the mice that got microbiomes from the lean twin, they stayed lean. The ones that got it from the obese, they became obese. If you look here, change in body composition. If you look at the lean donor mice, they did not change. They stayed exactly as they were. When they got the microbiome from the obese twin, they gained a significant amount of fat mass as well as a lean body mass. So they just became bigger, but proportionally they gained a lot more fat than lean body mass. If you look at changes in fat mass, the lean donors, no change. The obese donor mice, they went up about 10 to 11% in fat mass. Again, if you look at changes in fat mass, the obese twin, you see an increase in fat mass, and the lean twin, no change in fat mass. Now, so that's very interesting. What they found out here is if you take the microbiome from a human that's obese and put it into mice, the mice become obese. If you take microbiome from a non-obese human and put it into these mice, they stay the same. This study seems to implicate that the gut microbiome can cause obesity because these mice were fed the same diet, so their diet didn't change. But just changing the gut microbiome made these mice more obese. Now, does this work in people? Well, there's no study in people because people aren't signing up for this study. However, there's a case report. And this is the case report, and this was published in the Open Forum for Infectious Diseases in 2015. The title is Weight Gain After Fetal Microbiota Transplantation. Fetal microbiota transplantation is a promising treatment for recurrent Clostridium difficile infection. We report a case of a woman successfully treated with FMT who developed new onset obesity after receiving stool from a healthy but overweight donor. This case may stimulate further studies on the mechanisms of nutritional neural microbiota access and reports of outcomes in patients who have used non-ideal donors for FMT. Okay, so Clostridium difficile infection is, so this is an infection by a bacteria called C. difficile, which causes pretty serious diarrhea and can lead to death. So it's a very serious infection. And this is usually caused by use of antibiotics. So here's the case report. 32-year-old female with recurrent Clostridium difficile infection underwent FMT at our center. She had initially presented with 7 months previously with a 2-3 week history of diarrhea and abdominal pain after antibiotic treatment for bacterial vaginosis. So basically, she had bacterial vaginosis. Her doctor gave her antibiotics, and then that led to bacteria. And she was also exposed to a family member who'd had CDI, so she came into contact. Then she got colonized with this C. difficile bacteria, and started having really bad diarrhea from that. She was treated by metronidazole. So the treatment for C. difficile is usually metronidazole or vancomycin, and she was treated with both. She got metronidazole, got partially better. Then she was treated with oral vancomycin. That got somewhat better, but then she had another round of oral vancomycin. That didn't happen. That didn't get better. Then she was prescribed a course of rifaximin and Saccharomyces and this yeast. But then that didn't help either. So basically, she was getting worse and worse, and they decided that they needed to do this FMT, which is fecal microbiota transfer, or also known as gut microbiome transfer. After extensive discussion, the patient elected to undergo fecal transplant. As requested, her 16-year-old daughter was chosen as her donor. So she was going to get the gut microbiome from her 16-year-old daughter and get that placed into her. Her daughter was not obese, around 140 pounds, BMI of 26, but later her daughter became obese soon after this. Her daughter was otherwise healthy and didn't have any problems, and then they got some stool from the daughter. This sounds a little gross, but this is a very well-established treatment for Clostridium difficile. It's very effective. And what they did is they suspended the stool, and then they infused it using a colonoscopy scope. And then when they did that, the patient was cured of her Clostridium difficile infection. And that was no longer a problem. However, 16 months afterwards, she reported an unintentional weight gain of 34 pounds. So she used to weigh 136 pounds and was not obese, the patient. And then she weighed 170 pounds and became obese, BMI of 33. She had not lost any weight over the months she was being treated for the diarrhea that she had, and she has been unable to lose weight despite a medically supervised liquid protein diet and exercise program. Her serum cortisol and thyroid panel were normal. She continued to gain weight despite efforts to exercise and diet, and at 36 months post her transplant, her weight was 177 pounds, BMI of 34.5. She also developed constipation and unexplained dyspeptic symptoms. Okay, so basically, this is a case report of a person who was not obese, then got a gut microbiome from an obese person, and then she became obese despite efforts to lose weight with exercise and a liquid protein diet, which doesn't sound like the best diet, but anyways, whatever the case, it was a rapid weight gain after this transfer. Now, this is just one report, so we don't know. We can't say for sure that the gut microbiome transfer is what caused the weight gain, but it does seem pretty suspicious. So this paper, in combination with this study in mice, makes it somewhat likely that the gut microbiome does play a role in weight gain. And so there is this thought process of using gut microbiome transfers from lean, non obese, healthy donors into obese patients as a way of possibly losing weight. These studies are currently being done. There's not very many of them, but it is an interesting idea. The good news is that in this gut microbiome study in mice, when the lean mice were housed together with the obese mice picked up the microbiome from the lean mice and not the other way around. And the obese mice tended to become more lean. Um, so unfortunately, the way the mice get this is they eat each other's poop. And people generally don't eat each other's poop. So it's very unlikely that living next to a lean person would let you transfer the microbiome from them that way. But it is kind of encouraging that the lean microbiome is more invasive than the obese microbiome. So the tendency is for the more normal, healthy microbiome to take over when given the chance. So in people, it's possible that by changing the diet, you could change your microbiome to a more lean and healthy microbiome. And there's a video on the channel talking about how to improve your gut microbiome. And I'll try to link that above here. All right. Well, I will link both of these papers in the description. Hope that was interesting to you guys. Thanks for watching.